I am Dr. Laura Moreno, and in this video, I want to talk to you about high cholesterol, a condition that is extremely common and yet deeply misunderstood. Many people believe that high cholesterol has no symptoms at all, that it's something you only discover by accident on a blood test. And while it's true that cholesterol can remain silent for a long time, the body often gives subtle signals that are easy to ignore, misinterpret, or normalize. High cholesterol is not just a number on a lab report. It reflects how fats are being transported in your blood and how your blood vessels are responding over time. When cholesterol levels stay elevated, they slowly affect the flexibility and health of your arteries. This process is gradual, which is why the signs are rarely dramatic at first. One of the earliest and most common signs people notice is persistent fatigue. This is not the kind of tiredness that comes after a busy day. It's a deeper lack of energy that doesn't fully improve with rest. When blood flow becomes less efficient, tissues may not receive oxygen as effectively, and the body compensates by slowing down. Another subtle sign is reduced tolerance to physical activity. You may notice that activities that used to feel easy now leave you more tired or short of breath. Many people assume they are just out of shape or getting older without considering circulation as a possible factor. Some people experience a feeling of pressure, tightness, or discomfort in the chest during exertion. This does not always feel like pain. It can be vague, mild, and short-lived, which is why it's often ignored. The fact that it goes away with rest makes people dismiss it, even though it deserves attention. Cold hands and feet are another signal that can be related to circulation changes. When blood vessels become less flexible, the body prioritizes blood flow to vital organs, sometimes leaving the extremities feeling cold more often than usual. Tingling or numbness in the hands and feet can also appear in some people. While these sensations have many possible causes, long-term circulation changes related to cholesterol can contribute, especially when symptoms are symmetrical and persistent. Changes in the skin can sometimes provide clues. Yellowish deposits around the eyes or on the eyelids, or fatty-looking bumps on certain areas of the body may be related to how the body processes fats. Not everyone with high cholesterol develops these, but when they appear, they are meaningful. Frequent headaches without a clear trigger are another symptom some people report. This does not mean every headache is caused by cholesterol, but when headaches are persistent and combined with other signs, they warrant evaluation. Some people notice blurred vision or brief visual disturbances. The small blood vessels in the eyes are sensitive to circulation changes, and early vascular issues can show up there sooner than expected. Another sign is a feeling of heaviness, cramping, or discomfort in the legs when walking, especially over longer distances. This often improves with rest and is frequently mistaken for muscle fatigue rather than a circulation issue. Having one of these signs does not mean you have high cholesterol. These are not diagnostic symptoms, but when several appear together, when they are new, or when they are progressively worsening, they are worth paying attention to. One of the biggest mistakes people make is waiting to feel really sick before checking cholesterol. By the time symptoms are obvious, blood vessel changes may already be advanced. Cholesterol-related damage happens quietly and accumulates over years. That's why testing is so important, and not just any test. Many people only get a total cholesterol number. While this provides some information, it does not tell the full story. Cholesterol needs to be understood in parts. LDL cholesterol is often called bad cholesterol because higher levels are associated with plaque buildup in arteries. Knowing your LDL level is essential, but it should always be interpreted in context. HDL cholesterol is often called good cholesterol because it helps transport cholesterol away from blood vessels. Low HDL can increase risk even when total cholesterol doesn't look very high. Triglycerides are another critical piece. Elevated triglycerides are often linked to diet, insulin resistance, and metabolic health. They significantly increase cardiovascular risk when high. A complete lipid panel includes total cholesterol, LDL, HDL, and triglycerides. This is the minimum set of tests you should ask for if you want a clear picture. In some cases, additional tests can be useful, especially if there is a strong family history or if results don't match the clinical picture. These tests look at how cholesterol particles behave, not just how much cholesterol is present. Cholesterol should never be evaluated alone. Blood pressure, blood sugar, waist circumference, and family history all influence how risky a given cholesterol level actually is. Another important point is that cholesterol problems are not limited to older adults. Young people can have high cholesterol, especially when genetics are involved. Feeling healthy does not mean cholesterol is normal. Lifestyle plays a huge role, but genetics matter too. Two people with similar habits can have very different cholesterol levels. This is why guilt and blame have no place in this conversation. Diet influences cholesterol, but not in simplistic ways. It's not just about avoiding fat. Highly processed foods, excess sugar, and refined carbohydrates play a major role in lipid imbalance. Movement helps the body use fats more efficiently. Regular physical activity improves HDL and supports blood vessel flexibility. Consistency matters more than intensity. Sleep is often overlooked. Poor sleep disrupts lipid metabolism and increases inflammation. Improving sleep quality can positively affect cholesterol levels. Chronic stress also influences cholesterol. Stress hormones affect how fats are released and stored. Managing stress is not optional for cardiovascular health. Medications are sometimes necessary. When they are used to reduce long-term risk, not because someone has failed. Lifestyle changes and medication often work best together. Ignoring high cholesterol because you feel fine is one of the most common and dangerous mistakes. The body adapts quietly until it can't anymore. Paying attention to subtle signs, asking for the right tests, and understanding what the numbers actually mean allows you to act early, make informed decisions, and protect your blood vessels before serious complications develop, while continuing to build awareness of how your body communicates imbalance long before it reaches a point where it can no longer compensate. And as you continue to understand how cholesterol affects the body over time, it becomes clear why those subtle signs deserve respect. Blood vessels are not rigid pipes. They are living tissues that respond every day to what flows through them. When cholesterol remains elevated, those vessels slowly lose elasticity, and that loss affects the entire system, not just the heart. One of the changes people often notice without connecting it to cholesterol is slower recovery after physical or mental effort. You may still be able to do what you've always done, but you need more time to recover afterward. That lingering fatigue is not just about age or stress. It can reflect how efficiently blood and oxygen are being delivered. Another overlooked signal is muscle discomfort that appears with activity and improves with rest. This can feel like heaviness, tightness, or cramping, especially in the legs. Because it comes and goes, many people ignore it. But muscles depend on adequate circulation, and when blood flow is limited, they fatigue faster. Some people notice that small cuts or bruises seem to take longer to heal. Healing requires oxygen, nutrients, and efficient circulation. When vessels are not functioning optimally, repair processes slow down, even if the change is subtle. There is also a connection between cholesterol and low-grade inflammation. Chronic inflammation does not feel like a fever or sharp pain. It often feels like stiffness, heaviness, or a general sense of not feeling well. Over time, inflammation and cholesterol reinforce each other, quietly increasing cardiovascular risk. Digestive changes can also appear indirectly. The digestive system is highly sensitive to blood flow. Some people notice bloating, discomfort after meals, or sluggish digestion without an obvious dietary trigger. While not specific to cholesterol, these symptoms can be part of a broader picture of reduced vascular efficiency. Another area where circulation matters is sexual health. Adequate blood flow is essential for normal sexual function in all genders. Changes in this area are often attributed to stress or aging, but vascular health plays a key role and should not be overlooked. Mental endurance can also change. You may find it harder to concentrate for long periods or feel mentally drained sooner than before. This doesn't mean cognitive decline, but it can reflect subtle changes in blood flow during sustained mental effort. Now let's return to testing, because knowing which tests to ask for can make the difference between confusion and clarity. A standard lipid panel is the foundation. This includes total cholesterol, LDL, HDL, and triglycerides. These numbers together provide far more information than any single value alone. LDL cholesterol is often treated as the main target, but context matters. A moderately elevated LDL in someone with multiple risk factors is more concerning than a higher LDL in someone with no other risks. HDL cholesterol should not be ignored. Low HDL increases cardiovascular risk even if other numbers appear acceptable. Very high HDL is not always protective either. Balance matters. Triglycerides are especially important because they reflect how the body handles energy, sugar, and fats. Elevated triglycerides often point toward insulin resistance and metabolic imbalance. In some cases, additional blood tests can help clarify risk. These may include markers related to inflammation or long-term blood sugar control. These tests are not for everyone, but they can provide useful context when cholesterol results are borderline or confusing. Family history should always be part of the discussion. If close relatives had heart disease or stroke at a young age, cholesterol numbers carry different weight. Another important concept is trend. One isolated test is a snapshot. Multiple tests over time show direction. Is cholesterol rising, stable, or improving? That information guides decisions more effectively than reacting to a single result. Testing should be done thoughtfully. Acute illness, poor sleep, stress, or major dietary changes can temporarily affect results. Understanding this prevents unnecessary alarm. Now let's talk about practical actions, because cholesterol management is not about extremes. Dietary changes work best when they are sustainable. Reducing highly processed foods, refined carbohydrates, and trans fats can significantly improve cholesterol balance over time. Adding fiber-rich foods supports cholesterol elimination. Healthy fats matter. Not all fats are harmful. The quality and balance of fats influence how cholesterol behaves in the body. Regular movement improves cholesterol metabolism and vessel flexibility. Consistency matters far more than intensity or perfection. Sleep supports hormonal regulation that directly affects lipid metabolism. Chronic sleep deprivation undermines even the best dietary habits. Stress management is not optional. Chronic stress influences how fats are stored and released. Learning to regulate stress supports healthier cholesterol levels. Weight changes, even modest ones, can improve lipid profiles in many people. The goal is steady progress, not rapid change. And finally, medication decisions should be individualized. Some people need medication because their risk is higher, regardless of lifestyle. That is not a failure. It is a preventive strategy. High cholesterol does not demand fear, but it does demand attention. When you listen to subtle signs, ask for the right tests, and take consistent, informed steps, you shift from reacting to preventing, giving yourself the best chance to protect your blood vessels, your heart, and your long-term health while continuing to build a clearer understanding of how your body signals imbalance long before serious problems appear. And that understanding often changes how people relate to their health overall. Instead of waiting for a diagnosis or a crisis, they begin to notice how the body responds day to day. Cholesterol becomes less of a label and more of a signal that reflects long-term habits, stress levels, recovery, and internal balance. Another subtle sign some people experience is a sense of heaviness or pressure after meals, especially large or rich ones. This isn't just about digestion. After eating, blood flow is redistributed, and when vessels are less flexible, the body may struggle to adapt smoothly. This can leave you feeling sluggish or uncomfortable for longer than expected. Some people also notice that they feel more tired after sitting for long periods. Standing up may feel heavier than it used to, not dizzy exactly, but effortful. This can reflect how efficiently blood is moving through the system, especially when vessels are under strain. There's also the connection between cholesterol and blood pressure. These two often rise together, quietly reinforcing each other. When blood vessels lose elasticity, pressure tends to increase, and higher pressure further stresses vessel walls. This cycle can continue for years without obvious symptoms. Skin temperature changes can be another clue. Hands or feet that feel consistently cooler than the rest of the body may point towards circulation adapting in less optimal ways. This doesn't mean severe disease, but it does reflect how the body is prioritizing blood flow. Some people notice subtle swelling in the ankles or feet by the end of the day. While this has many possible causes, circulation efficiency plays a role. When blood return from the lower body is less effective, fluid can accumulate. Another area that often goes unnoticed is breathing comfort. You may not feel short of breath, but you may notice that deep breaths feel less satisfying during exertion. This can be related to how efficiently oxygen is being delivered and used. Emotionally, people sometimes report feeling less resilient. Stress feels heavier, recovery from emotional strain takes longer. While this is multifactorial, vascular and metabolic health contribute more than most people realize. Now, when it comes to asking for tests, clarity matters. Many people feel intimidated in medical settings and hesitate to ask questions, but understanding your numbers is part of taking care of yourself. It's reasonable to ask for a full lipid panel rather than just total cholesterol. It's reasonable to ask how your results compare to your previous ones. It's reasonable to ask how your personal risk factors influence interpretation. Another helpful question is whether additional monitoring is needed over time. Cholesterol trends are far more informative than single measurements. It's also important to understand that lifestyle changes don't show up immediately in blood tests. The body needs time. Expecting instant results often leads to discouragement and abandonment of healthy habits. Consistency matters more than intensity. Small changes repeated daily shape cholesterol behavior over months and years. Another key point is that cholesterol management is not about eliminating all fats or living in restriction. The body needs fats. What matters is balance, quality, and context. Highly restrictive approaches often increase stress, disrupt hormones, and backfire. Sustainable habits support better outcomes. Movement doesn't need to be extreme. Regular walking, daily activity, and avoiding long periods of inactivity all support healthier blood vessels. Sleep supports repair. During deep sleep, the body regulates hormones that influence cholesterol production. Poor sleep quietly undermines these processes. Stress regulation supports the nervous system, which influences vascular tone and metabolism. This is why stress management has physical effects, not just emotional ones. Medication, when needed, works best when combined with lifestyle support. These approaches are not opposites. They are complementary. High cholesterol is not a verdict, it is information, and information gives you options. When you learn to listen to the quieter signs, understand your test results, and respond with steady, informed actions, you move from uncertainty to clarity. You stop guessing and start partnering with your body. That partnership allows you to protect your cardiovascular system gradually and deliberately, while continuing to notice how small signals guide you toward choices that support balance, resilience, and long-term health in ways that often go unnoticed until attention is finally paid. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we explain health topics clearly, calmly, and without unnecessary alarm. Share this video with someone who might benefit from it, leave your questions or experiences in the comments, and join me as we continue learning how to listen to the body, understand early signals, and take informed steps to protect long-term cardiovascular health.